Hello, everybody. Welcome. This is your girl, Donna D, aka the Urban Mommy, and I am back with another podcast. Today, we have a special guest by the name of Annterria Bruce, and she is a women's health professional. Would you like to describe yourself to everybody? Who is Annterria?
Yes, hello everyone. My name is Annterria Bruce. I'm a women's health nurse practitioner. I'm operated out here in Houston, Texas, but I'm from New Orleans, right where Donna's from. So I am also the owner of Majesty, which is feminine products, and Majesty Women's Center, where I offer women's health services.
Okay. Can you tell them how, for a lot of women, especially women of color, we always try to look for a doctor that can understand us and knows a little bit about us. How important is it for women to know that represent, you are a woman of color? I'm sorry.
So, women of color are like 2.5 to 3 times more likely to not be heard when they go to their doctor visits, to even die while they're giving labor. So I believe in advocacy for yourself. I always tell my patients, I need you to speak up. If you understand something, ask more questions. And what I'm doing now, because I find that a lot of the times you have with your doctor, the time is cut short because they have like 20 or 30 patients trying to see a date. The type of center that I open, I just want to be able to spend more time with them, offer them more like time to ask them questions to address their concerns. So I will behoove you to look for credible resources from a provider. Go in there with your questions already, and hopefully you'll get some type of understanding. If you don't, just request another visit.
Okay. Maybe about 2 weeks ago, I had a lady on a podcast, and she was a white lady, but she was talking about medical gaslighting. So she spoke about how difficult it is and how a lot of doctors, some of them are taught that black women can endure pain a little bit more than others. And this was even with childbirth. So, do you have any information on that? Have you heard
Yes,
that before?
yes, I've heard that before. It was actually embedded during a time when slavery was going on here in America. It was a doctor. He was actually experimenting on their black women slaves, and he would give them no anesthesia. So he was doing these procedures that we do today without anesthesia. So that image is, and his teaching was in a lot of the medical textbooks. And so
Wow.
it's embedded into their head that, oh, we can take pain and we can endure pain. We don't need pain medicine. When we actually need help or screaming out for help, we're not being listened to, and it results to morbidity or mortality. So I agree. Yes, it is. It's an issue, but I do think that um, they're kind of like moving towards inclusive medical care for women of color, and they are not changing the game. And the doctors that I see come out that I work with now, I can definitely tell a difference into their patient care for women of color.
Wow. Okay. So that's big, and it's important that, like you said, that we actually speak up for ourselves when it comes to that. When I got a IUD a couple of years ago, and I have a question about that because that was when I first got it. They were saying that it lasts 5 years, but
Hmm.
now and then when I called them, it's like, hey, I'm at my 5 years. They were like, oh well, no, we're hearing that it goes 10 years now. So is that true, or should I try to get this thing out?
No, it's true. It's true, but I thought I read it was 8 years.
8.
So
Okay.
I thought I read it was 8 years, but it could have been 8 to 10. Now they do have an IUD that is for 10 years, but that is the non-hormonal IUD. But I would not recommend that one if you already had heavy bleeding before it, because it will cause you to bleed even heavier. But yeah, new studies have came out. Actually, United Kingdom already was leaving them in for eight years in United Kingdom. United States is kind of behind on that. So yeah, it does last 8 years.
Wow. Now I believe I have the non-hormonal one, but the reason why I got mine was because every time it was time for PMS, I would feel like really, really bad. I would have horrible headaches. I would have like extreme back pain, and my doctor said because I had headaches that I should not get the birth control that had hormones in it.
With the estrogen, yes.
Yes, with
Yes.
estrogen because they said that you could be more likely to have a stroke.
Yes. Estrogen, yeah. Synthetic, the hormones in the birth control is synthetic hormones, is actually made from horse's urine. I don't know if a lot of women know that. so,
Wow.
so the risk factors associated with estrogen is, like I said, headache, stroke, blood clots, heart attack as well. So you just have to be very careful, especially if you smoke or if you're overweight when you bring on synthetic hormone.
Wow. So that's the one that I have, like Mirena. I think Mirena.
So Mirena is progesterone. That's
Okay.
actually good. Yeah, that's
Okay.
a it doesn't have estrogen in it.
Yeah. Okay. So progesterone is okay. Estrogen is the one that I need to watch for.
Correct.
Okay. All right.
Yeah.
Yes, because that's the one I have, the Mirena. And actually, when I got mine, it was a little painful. Is that normal? They thought I was being a baby, but I thought it was a little painful.
See, they should. I hate when they do that. For when I was in training for a nurse practitioner, the nurse practitioner that I followed with, when she would insert IUD, she would numb the cervix with lidocaine. So I noticed that now a lot of providers offer the lidocaine numbing medicine before they insert the IUD.
Mm, okay.
So I do see that some providers might say, "Hey, take Tylenol, ibuprofen um, before the procedure." But when you think about it, it may not really be beneficial, really give you that pain relief because the device that they use to put the IUD is teneculum, and the teneculum actually clamps down on your cervix. And it just me saying that right now, I'm like, ugh, that's one reason why I don't even want to.
Yeah, cause
I know it's convenient because you don't have to take medicine and pills every day, and it lasts for up to 10 years for some of them. But yeah, this should offer lidocaine. If a lot of women don't know that, and so I actually just made a TikTok when I was like, hey, ask for when you call to make your appointment, see if they use lidocaine. If not, find your doctor that does use lidocaine to do IUD. Even though it's quick, but it's still like, come on now. If it
it's
was a
painful
man,
and it hurts, and your stomach is like cramping for like a day or two after. Like it actually hurts. And when I called in, I was like, "Look, I'm in pain. I don't handle pain well." And they're like, "Oh, that's okay. That's your stomach is just contracting. That's because you have a foreign object inside of your stomach. Take some ibuprofen." That was pretty much all I got. But that was not a pleasant uh, situation.
experience, yeah. And I feel like when they do men procedures in office, they offer men numbing medication or whatever's pain relief. I think they should change the narrative with that and be more like cross the board. Give us some more pain relief.
Right. Okay. So when you started Vajesty, it was actually a couple of years ago. So congratulations, by the way, because I remember when you first started it, and you are doing so well with it. So what made you actually start it?
Well, I knew in while I was going through nursing school, my master's program, that I didn't want to traditionally work Monday through Friday 9 to 5, and I wanted to start my own business. I wanted to be an entrepreneur, and I wanted to grow generational wealth. And I figured with my expertise and my own personal story that I should start a business in women's health. It just made sense. I had the background, I had the experience, and I had the ambition, the motivation to start generational wealth. So that what made me start Majesty.
Okay. So do you go out? I know you do a lot of speeches. Do you go out to schools and talk to kids a lot about sexual health? Because they don't really have those in schools anymore, right? Not too much.
Not too much. No, I have not actually went into the schools. But I do have Majesty University where I do like online courses, and one of the courses is called My First Menses. And in that course, I teach young girls about their menstrual cycle, everything you need to know about your menstrual cycle, all the way down to like the products, how to properly throw them away, and things like that. And I do mention ovulation. I'm getting ready to like revamp it because I want to put in there about like sexual health as far as like infection and things like that, because you know young girls are, well, kids these days are experimenting early on than what I remember in middle school. So
Right.
so I feel like the education need to be there from a credible source, and then sometimes the parents do not know. So I rather them learn from like a professional than learn from the streets and get it the wrong way.
Right. I'm glad you brought that up because that was actually going to be one of my questions. So my daughter makes 10 tomorrow. So like my cousin and me like, oh, you got to start having a talk with her. And I'm like, I'm not ready. But I know some girls can start getting a cycle really early. But I'm glad you say you have that website because I literally don't know what to do. I know I wanted to order the little panties that have the stuff inside of it.
Yeah, the period panties. Yeah.
The period panties. I want to do that, but I guess I don't know how to even have that talk and then make sure that she understands. But I know kids understand more than we think they do. But I'm
Right.
glad. So
So yeah,
you think it would be good for a 10-year-old?
yes. Actually, the course is good for ages 8 to like 16.
Okay.
Yeah. So definitely
Well,
recommend,
definitely.
especially for moms who don't know where to begin when talking about their to their daughters about their cycle. So yeah, it's definitely good for that.
Okay, I'm gonna definitely get her started with that. So also that we're speaking about teens, I noticed like I said that they don't have too many classes anymore, and I feel bad because I never had to talk with my boys, and now I'm thinking about it like I probably should have done that, and like how I can do that because the oldest one is crazy the stuff that they say about sex, and you think that they know. So, what's a
Hmm.
good age to start talking to your kids, and how do you suggest that we do it? Because they have so much influence from the outside world about sex. So, and that's my fault for assuming that they knew and never actually sitting down and telling them what they need to know.
So I think the appropriate age, especially for girls, um, when you're going through puberty. So I started with my daughter about 8 years old, and at this time, I got her together a little period kit to put in a book sack. And then during that time, I had a slideshow that I had for nursing school way back in like 2010, and I went over STDs with her. Because at this point, they're going through puberty, they may get curious, and I want her to know that you need to, I don't want you to do this, but I can't be with you 24/7. But you need to know that there are things out there that you cannot give back, that you cannot take medication for and it goes away. So I just wanted her to be aware of, what's out there in the world. So I think for young men at the same time when they're going through puberty, there should be a perfect time to talk. They might say, "Oh, well, I don't like girls," and still have that talk, still have
You
that
still
talk
gotta
with them.
talk to them. Yeah,
Yeah.
because talking to my son that's old, and you would think that they know stuff like the stuff that he says. So there was a situation with a girl that said she was pregnant, right? So I'm
Mm-hmm.
like, okay, we're gonna deal with it. And then she literally just finished having a baby, so we're gonna talk about that because I saw you had that on your TikTok. Just
Mm-hmm.
finished having a little baby, and now she's pregnant again. This was a couple of months ago. She was pregnant
Okay.
again, and he was like, I don't think it's mine because we've been having sex. If it's my baby, she would have been got pregnant. I'm like, that's not how it works.
Mm-hmm.
Like that's not how it works at all.
Well,
So it's
how old is
like
the first? How old is her first baby?
that baby. I don't think that baby 1 years old yet. Still, I don't think that baby's one.
Okay.
So it was, and a lot of times also us in the black community and us in from New Orleans, we have a lot of old wives' tales. So we believe a lot of stuff, and I don't know if any of that stuff is rooted in like actual factual history, but a lot of stuff like we say like right after you have your baby, you're more likely to get pregnant. I don't know if that's a real fact or that's just what our grandparents told us.
No, you could get pregnant. There are people that come at the 6 week checkup and pregnant. So
Already, right?
yeah. And just
And
like women who breastfeed don't think they can get pregnant, but breastfeed alone is not a good source of protection for pregnancy.
okay, I also heard that girl, some children they think that if they have a STD, that mean they can't get pregnant. Like I heard the craziest things when I came when we were having this conversation.
So it's not that they can get pregnant if it goes untreated and it turns into pelvic inflammatory disease. It can
Okay,
cause infertility. So this is why it's
gotcha.
important for parents to talk with their children. Because I've had some messages from teen girls. I'm like, I'm scared. I can't talk to my mama. But if you have this yellow discharge, I'm gonna need you to talk to your mama or a trusted
Mm,
adult because you're at risk for pelvic inflammatory disease, which can put you at risk for infertility. So when you do decide to have children later on in life, you may not be able to have kids. So it's very important that parents create this space where the kids can trust them and come talk to them about things. Even if they mess up, you still need to develop that, create that safe
Right.
space for them.
So how do you suggest? I guess one way is probably starting when they're a lot younger, like your baby. Start when they're 8, 9 years old.
Yes. And then that's too depending on their my
Maturity
daughter is
level.
very mature for her age. Like she was 8, but had a mind of a 10 and 11-year old. Like she
Right. That's
open
my.
stuff
That's
to
how my
me.
daughter is. She's like that too.
Yes. So if they're 8 and they're acting like they're 5 and 6, then no.
Right. Right. I was thinking back, and it's funny. I could say the story now, but I remember I was in Nord's ballet. So it's like a for people that don't know what that is. It's like Nord is our city agency that's recreational department. So it's low income ballet. So it was a bunch of kids, and we sitting around talking. And some of the girls were older than us. I was about 7 at the time, and I remember I was dressed out, and the girls was talking about wearing their leotards, and they was saying pads, and they were saying words that I didn't know what it was yet, and they started talking about having a period. So me and my cousin would always be listening, and we knew periods was for big girls, but I never knew it was blood. So every time I used the bathroom when I was small, I would look in the toilet and see if I saw, I swear, like a little black dot,
Uh-huh.
because I thought that was my period. I was like, oh, that's my period, but I never talked to my mama about it. So this was me trying to do all this stuff in my head. My mama didn't even know I was thinking about stuff like that, but that's because I'm hanging with older girls. So
Right.
it's important to put the right information in front of them so that they don't go try to find information from other places.
Exactly. Exactly.
Right. Okay. So can we talk a little about a bit about STDs and I think they call it STIs now.
Yes. Mm-hmm.
Okay. Can we talk a little bit about that now?
Yes. Yeah. So sexually transmitted infection, you get it from having sex. You have the bacterial infections such as chlamydia, gonorrhea, trichomonas. I feel like I'm leaving one out. Probably not. And then you have the viral, which is like herpes type 1 and type 2. And then you have HPV. Now, HPV can cause cervical cancer. And ladies, this is why it's important to make sure you go and get your pap smear. So that way they can screen you for HPV. And if it shows signs of cervical changes that's caused by HPV, the appropriate treatment can be addressed.
Is that the one that we take Gardasil for?
Yes, that's the one.
Okay. I was actually one of the trial groups when they first was bringing Gardasil out. So I took it
Okay.
years ago. I
Yeah.
took the Gardasil. So that's what HPV. All right. So you say viruses, that's like herpes. What was the one you
Herpes
said
type
that was
2, um, and HPV is sexually
HPV?
transmitted. It can cause cervical cancer. Oh, I forgot about syphilis because I've seen a enormous amount of syphilis patients.
Really?
Like, yes, I would have thought that would have been kind of like a old
Gone,
like
right?
disease. Yeah, but no, it's coming back. So y'all be careful, wrap it up, and you determine syphilis. Sometimes it may cause you to have a sore, but it's usually you have to do blood work for syphilis.
For herpes too, right?
Yeah, for herpes, do blood work, but you can also, depending on the outbreak, the doctor may do a swab as well.
Okay. So what about the saying that I think it's like 70%, I might be making up these numbers, but like 70% of the people have herpes but don't even know that they have it.
Yes, because it lives dormant in our body, so you don't. Not everybody get a breakout.
Outbreak. Wow.
Yeah, yep. Not everybody gets that, and so what causes it to come out for some people is like stress.
Hmm.
Even in pregnant women, if they're HSV positive, we will give them treatment. The antiviral medication start around 34 weeks because when you're pregnant, your immune system is suppressed. And so if they have an outbreak, they can't deliver the baby vaginally. So we start around 34 weeks with the treatment, and they'll take it all the way up until they deliver. However, if they do have an outbreak, say she didn't get adequate prenatal care, she'll have to do a C-section. Otherwise, the infection, the virus can transfer to the baby, and the baby can get really sick.
Wow. Okay, so with that, I know there's been a lot of changes. I remember at one point HIV they had to have a C-section. Now some people with HIV can have natural births.
Yes, yes. But the only thing is, as far as like breastfeeding goes, um, you can't breastfeed.
Oh. So how is it that they can have a baby? They just can't. I guess because the it's different because it's inside your body. I
Yeah,
guess, right?
right.
Oh
Yeah. And
wow.
then the medications they have now on the market, I'm glad you brought up HIV because listen, if you're out here living your life, no judgment zone. I don't know if you heard of the medication called PrEP, ladies. Get on PrEP. PrEP prevents you from getting HIV. Only thing is you'll have to get blood work like every three months because it may increase like you got to check your kidney and liver functions, but get on PrEP. That's for ladies and men too as well. Okay.
Okay.
Now living with HIV, you can go undetectable and not transmit it with like one pill a day. I forgot the name of it, but I know PrEP is used if you do not have HIV and you want
Okay.
to prevent yourself from ever getting it. You can get on PrEP, and I don't think it's expensive. Like you might have to
Wow.
pay a copay, or it might be free depending on where you get it from.
I think prep is probably free because everywhere you look, they're trying to promote it, but they
Yeah.
promote it. I didn't even realize that the heterosexual people. Not, I'm not saying that they can't get. That's not what I was about to say. What I'm saying is the commercials look like they only appeal to homosexuals. So it's common
No.
for heterosexuals to take it as well.
Yes, I know of a lady. She said, "I'm dating." That's what she told me. She said, "I'm dating, and so I just want to make sure." And she take it. You just never know because people are not honest.
That's true.
People are
Even
not
if you're
honest.
married, sometimes it's the same situation. Like one of the families that I knew had the same situation. He was married and he was cheating on his wife, and
Mm,
unfortunately she contracted it. But I mean, this was in the '90s. This was years ago. Um, and I think she actually got it, but the other woman who he had that was actually pregnant for him did not get it.
yeah, that can happen.
Wow. All right. So, what is the strangest question you've ever gotten?
The strangest question.
Mm-hmm.
Um, I might think it's strange to me,
Mm-hmm.
but um, it's not really like a stupid question. I wouldn't say like if I have the vaginal suppositories that I have, and it says
Mm-hmm.
suppositories, they're like, so do you swallow it? And I'm like, no. Please read the bottle. Do not swallow these pills.
Right.
Um, and about the period panties, I know, and the period disc, I know it's like new period products on the market. Um, and they ask, well, how do you wear it? How do you insert it? I know it's kind of like new to them, but nothing really like out of the ordinary that I get.
Okay.
Yeah.
Well, what about the most common question that you probably think that people should know that they probably are scared to ask? What's something that a lot of people probably ask you?
Um, I get a lot of questions about how to wash the vulva.
Mm.
And I say vulva because there's a difference between vulva and vagina. So, and quite frankly, just like people don't know too much about their menstrual cycle as an adult or just their body in general, I can understand how they don't know how to properly like wash their body down there.
Hmm.
So that's a question that I think that you should know. But hey, there was a lack somewhere between
Right.
the parent and the child with teaching. So yeah.
Wow. Okay. So, what about? I know you have some products as well. So you have like a health box. Can you explain a little bit about your box and what comes inside of it?
Yeah, so we have the Majesty Royal Collection box, and in the box is like pretty much everything you need. You have the full body wash, you have your vulva wash, you have wipes, you also have Yanni scrub. It's a full body scrub, but it's safe enough to go down there to help with ingrown hairs and discoloration. It also comes with a vagina, a vulva mask, I should say, and it comes with Yanni oil to also help with moisturizing down there.
So what is? I know I hear that word a lot. Yanni wash and Yanni. What is that?
So yani is another term for vagina
Oh,
of all.
okay.
Yeah, yeah.
Oh well, there go one of them questions that you think everybody
Some
know.
people might say yoni. I say yani. I guess it depends on who you talking to, what part of the world they from.
Right. Okay. So how important is it to use certain washes as opposed to using just anything that we find at the dollar store or Walmart?
Yeah, so you want to be careful, especially with those strong scented washes for your pH balance. First of all, nothing goes inside. No soap needs to go inside the vagina because it's self cleaning. Okay, so just gotta be careful with you need some like a mild sensitive soap for down there. You have to wash. I mean, they got some people say, I'm only using water. Listen, if that works for you, if that works for you. But see, mine, my skin, my vulva is skin. So it just like, don't you wash your face, right? You're gonna put a little clean in your face, right? So that's the same thing as for your vulva. You urinate, you sweat. Even your clitoral hood, it needs to be clean. People be having crust and cheese looking stuff around their clitoral hood. You have to clean it. So,
Wow.
like I said, if you want to use water that works for you, fine. As long as she's happy.
Right. As long as they get the job done.
Hmm.
So, something else we saw recently on Facebook. One of the videos went viral with this dude with this huge thing. I'm gonna just say that. Um, is there like some? And I see a lot of women, in the comments, making different comments, and they say that those big things that can ruin you. Is that true, or is that just
Well, from
what
what I
people
hear,
say?
everybody that's big don't know how to work it. So,
Yeah. Right.
so I think the pressure and depending on like the rhythm of the moment may cause a little damage, but not like to where it shifts something. I think
Right.
that's just like too far extreme. But
Right.
um yeah, it's not like that.
Okay. So they're not doing damage like that. So it's not
No,
what's not
they might
dangerous.
get up and be limping a little bit, but
It's a good limp.
yeah.
All right. So, speaking about that, we're gonna talk about like the home treatment. So a lot of women sometimes they treat themselves, because embarrassment or whatever. They don't want to go to the doctor. So if they think they have a bladder infection, they go get those pills. I see some ladies online, they be selling the boric acid pills to stick up there every time you with a partner. So what are some of those things? Have you heard about any of those? Is that safe?
Well, yes, I have the this is the boric acid suppositories. I don't
Hmm.
think I said that it come in a box. But yeah, this is actually our number one seller. So the thing
Okay.
with like treating yourself at home, for me, and this is one of the personal reasons why I started Majesty, I've had my chronic BV for years, so I knew what the symptoms was. If you're not sure the color of your discharge, then you need to go to the doctor. You see what I'm saying? If you're like chronically dealing with BV and you can, I know what this is. This the fishy odor. This the white to gray discharge is BV, or it's itching because it's a cottage cheese discharge. It's a yeast infection. If you know
Okay.
that, if you're in tune with your body, then I can see you taking a boric acid. But if the discharge is yellow or green and you're like, what is this? Do not use boric acid because that would not treat that. You need
Okay.
an antibiotic.
So what is the boric acid for?
So the boric acid helps you rebalance your pH. Our
Mm,
pH is 3.8 to 4.5, but when it's upsetted by either semen, because semen is alkaline, when it raises that pH to over 4.5, it can cause bacterial vaginosis. So that's what the boric acid do. It helps you restore your pH balance back to 3.8 to 4.5.
okay. Yeah, so because I think that's what the girl on the video she was saying that she take those every time she have a new partner.
Yeah, because having a new partner does increase your chances of getting bacterial vaginosis. It does.
Okay. I also saw that you made a video about foods that we should avoid during pregnancy. What are some of those foods?
So I talk about the cheese, as the cheese that's like Brie cheese, that's not pasteurized. Um, the shellfish, like the raw seafood, stay away from that. You also need to avoid like deli meat, but if you eat deli meat, you have to warm it up because those things have this bacteria called listeria, and it
Mm-hmm.
can cause you to get sick and even in some cases may cause you to have a miscarriage.
Oh wow.
Yes.
Okay. How has this thing with the new abortion law? How has that changed anything that you do?
Wow. In Texas, yeah, it has changed. I'm not happy about it, but I hope women know that there are options, and sometimes you just have to cross the state, you know. And someone told me the other day that as providers in Texas, we're not allowed to even mention the word abortion. But I wanted to look that up because we have women who go through at about 18 weeks you get an anatomy scan. Sometimes you see that the baby has this like chromosome defect.
Mm-hmm.
It may have some other issue where they will not survive outside of the womb. And women would have that choice to go ahead and terminate the pregnancy or go through with it and just, when a baby come and then just wait its course. But now they don't have that those rights. So I think that's very unfair that the government is trying to police our bodies like that and not understanding.
Wow. I didn't know that. So what about what is it? PCOS. There's a huge following for some groups on Facebook with PCOS. A lot of them are probably been diagnosed, and a lot of them are self-diagnosed, according to the page. Do you run across a lot of that? Is it as many women as it seems to be?
Yes, it's a lot of women who have PCOS. I actually have PCOS. So that's polycystic ovarian syndrome. And so it's a metabolic disorder. And some of the common symptoms that a woman may have is cysts on ovaries, insulin resistance, infertility, weight gain and trouble losing weight, hirsutism, which is unwanted facial hair, even depression may be also a symptom of PCOS. Having irregular cycles, that was my thing. Why I that's when I found out about me having PCOS. My period be gone for forever. I'm like, okay, the test is negative, so
Right.
what's happening? Yeah, yeah,
So, and that's another important thing about women health. Like sometimes we may have symptoms that can be 50 different things. That's why we really have to go to the doctor and ask questions because you may think it's something simple like, oh, I'm just having cramps. But like you said, it could be something more serious like PCOS or, something else, some other kind of condition that they have.
yes,
Okay.
that's
Uh,
true.
we talked about, the using the products in your body, but that's mostly the soap. So what other type of toxic products are there?
So it just depends on the ingredients that they put in the products. I can't name them right offhand, but you want to if it's gonna say like natural or sensitive, that's the ones you want to use those.
Okay. So like a lot of soaps are starting to come out now and it's just for like vaginas. So that's probably something that we can use.
Right. And then just look at the ingredients. And if you won't Google the ingredients and not everything on Google those are probably based on like a small amount of people. You just
Okay.
have to make the informed decision if you want to use the product.
Okay. All right. What about people that get boils a lot? I remember somebody had a question and they always get the boils like in a, I don't say private area, but what's the difference between something being a boil and something actually being like an outbreak or something? How would they really know?
It'll be the size and the shape of it, and if it's swelling. So like the Bartholinian cysts, those are caused by the inflammation of the Bartholin gland that's right down there. And
Yeah.
so you just go to the doctor and you can get those removed by incision and drainage. It just depends. Sometimes women have it where it keeps coming back.
Yes.
That reason I'm not aware of at this time. I don't really see a lot of that in my practice. But then with the outbreak, what I notice is that it has like little clusters around it, maybe oozing at the site or bleeding at the site, and it's painful or it burns to urinate.
Oh wow.
That's pertaining to like herpes outbreak.
So is it true that with people that with herpes, if they have a what you call it a fever sore, a fever blister or something, is that really herpes?
Yeah, that's type 1. The cold sore on your lips, yeah, that's type 1.
So even if it's like a child that have it, that still count as like herpes?
Yeah,
Wow. I guess that's from drinking from parents and stuff.
yeah, yep.
Wow. So that's important because a lot of I don't know if that's just because it's New Orleans, but they always put the baby nook in their mouth, pacifier, whatever y'all want to call it. They take the baby nook and they clean it off by putting it in their mouth.
Yeah, and they don't know. They probably don't know they have type 1, and so they're doing that, and they're not a baby got
You adding it to the
a
baby.
child.
Do
Right.
children? I mean, it can be dormant in children as well, but do children have any? Do you ever see any kids that come out and actually have problems?
No, no,
Okay, so they're
unless
pretty
like
much
I haven't seen a child with like type 2, but if it's type 2 in the child, I hope that child is not being violated.
molested.
Yeah, yeah.
Wow, that's scary. Okay,
I know.
that's extremely scary. So that's another issue. We have a lot of people that actually the lady who came on the show, she was talking about how she was molested as a child, and she was saying that it made her very promiscuous as an adult because
Yeah,
she was 9 and 10 years old. Do you have you ever had any situations like that or hearing stories?
yes, I do. I actually had a patient that came in and the way she was acting, I thought this was her first time. I look at her chart and I'm like, okay, so she's done this before. So something must have happened. Like this whole visit is triggering her. And so I asked, I'm like, did something happen before? And she started crying at this point. I could see in her face, but then when I asked her, she started crying. And then I start crying. I'm like, oh, I won't kill him so bad. Why would they do that to a child? But yeah, so I was able to talk her through the procedure, her pap smear actually, and yeah, it's heartbreaking. I actually also had a patient. She was recently a rape victim, and like yeah, those are not like good visits. I always wind up crying with them and just praying for them.
And now that I don't know how the law is in Texas, but in Louisiana, I think once our kids are 13, the
Mm.
parents aren't really privy to the information. We have to we have to get out the room
Yes, same
down
here
here after 13.
because they feel like the child is going to say as much when the parent in the room. And then it's like, okay, so if I know something is absolutely wrong, of course I'm gonna tell the parent. But we need to get it out the child first. We need the child to actually say it.
Wow, 13 is so young, but I guess, we living in a different days. 13 not young anymore. Did you notice like when we were younger, we had a lot of teen pregnancy? You don't see that much too often. Do you still see a lot of teen pregnancy?
Um, no, not like you said when we were younger. I don't see a lot of teen. They still have them here and there, but that goes again with not knowing when you're ovulating, when to avoid intercourse. So
Right.
yeah.
I wonder like what's the shift of why we don't see as many young girls pregnant like we used to.
They're
'Cause
probably on have more access to birth control now.
that's true. That's
That's what
true.
I'm
They
saying.
have more access. That's true. Okay, so let's pretend you have a young girl that comes to you and she's 15 and she's telling you that she's pregnant. She's scared to go talk to her family about it. What would you tell her?
Well, I hope she's scared to go to her family about it, but she thinks they're not going to support her in her decision. we just have to I would just have to encourage her to talk to someone, because she's not going to need to have like her prenatal visits to make sure her pregnancy is healthy. She's going to need support at home as well.
Okay, so do they usually have like maybe counseling or something that can help them get through situations like that?
Yeah, they have counseling. Yes, they have counseling that we refer to social work services as well, to give them resources for them and the baby.
Okay, I'm asking because I saw probably about 2 weeks ago there was a young girl that did the same thing. You know how they abandoned the baby, and she
Mm.
abandoned the baby and left it. So I was just thinking about that. Like, is that usually do we find that with cases where the parents are embarrassed? I mean, the kids are embarrassed to go to the parents.
Yes, that usually happen. They're embarrassed to go to the parents, or they're scared to go to the parents, or they're trying to say, okay, what they're gonna think. I let them down. It just depends. I've seen it across all socioeconomic status.
Yeah, I actually spoke with a young girl not too long ago, and she had a baby, and she was so embarrassed to go to her family. She hid the pregnancy for the entire 9 months, and she had a person come to the hospital with her, and she immediately gave the baby away. And I'm thinking her parents, her family don't even know like what happened, and it's, our kids are so scared to come to us that these are the things that they're doing.
Yes, and this is why again you develop that good relationship with them at an early age, so they can come to you. Like I tell my daughter, I know you don't want to tell me everything, but find you another adult that you trust, which is one of my good cousins, a couple of my good cousins. Look, go to them. That's what I did too. Me and my mama have a wonderful relationship, but certain things I was kind of afraid to tell her. So I had like other women in my life, like my aunties and stuff like that, and I was able to go to them. And then eventually, you know, that girl, let me tell you.
Right.
My mom would be like,
Definitely
"Well, why
go
you
red.
just didn't tell me that? Why you just didn't
Right.
tell me?" But not everybody have that village. What I'm
Right.
trying to say.
That's a
So
good one, and that's important because even if they don't feel like coming to you as the parent, they can come to somebody they trust. That's a good idea. I need to. I'm putting this note together for my own baby because I'm almost to that stage and I'm just not ready. All
yeah.
right, I saw on TikTok not too long ago. I think it was on your page. It's probably about a year ago at this point that you could stop a period if a period was coming and you have a date coming up. You can take something to make it not stop it but delay it.
Yeah. So the brand that you can do is seasonal. That's actually what I use for my honeymoon. Like I already had calculated. I was like, oh, my period gonna be down for my honeymoon. Oh, no, no, no. So I already got these pills called Seasonal. That's the brand I use, and I ain't have no. It stopped my period for 90 days. And when I was done, I went back to my regular birth control.
Oh
But
wow.
they all have some birth control that what we call continuously cycling, where instead
Mhm.
of you taking like the last pack to allow your cycle to come down, you just move on to the next pack.
Oh, okay. But
Yes,
definitely talk to your doctor so they could kind of walk you through that. I'm trying to
right, and
remember it was
prescribe you
something else
the right pills.
that they took. They put. I'm gonna look it up, but it's some. I'm at to send it to you, but it's some kind of medicine. Like they put Tylenol in water or something. It was something like that, and it stopped the cycle.
Oh, I haven't seen that. I haven't
I'm
seen
gonna
that.
find it. I'm gonna send it to you, but I thought I saw it on your page a long time ago. But it's some video and it maybe you will say that it don't work. I'm not sure, but I remember I saw it. I'm gonna have to send it to you. And it's something that you put in your water. Like I'm gonna just say, oh, Jello.
No, I haven't saw that. I haven't saw that. I haven't heard of that. But what I did do one time, I was getting ready for a party and my cycle was coming down, and my cousin said, "Get you a douche bottle and put some cold water in it and shoot it up.
That might have been
It's
it. I
gonna
know
stop
it's
it."
something like that.
Yeah, she said it's gonna stop your cycle. So it did stop it for that time, like for a couple of hours. Just say maybe like 3 4 hours, but then it came
Okay.
back flowing. Yeah.
Okay. All right. That's interesting. All right. I got one more, well, two more questions before I let you go. So, a lot of talk when it comes to sexual talk, stuff. A lot of women want to talk about orgasms.
Ooh, that's my favorite part.
So, a lot of women too many have not even had one, or they don't have them regularly. Can we talk a little bit about that? So they say, I don't know.
Ladies, when I tell y'all the the things we have available to us now is amazing. So if you're having problems with because there is a medical diagnosis for a female or orgasmic disorder. If you have problems with that, do not feel shamed. Do not be embarrassed. Seek professional help, even a sex therapist, pelvic floor therapist. There is medication to help. There is therapy that can help. There is different exercises that can help. And talk with your partner about it. Listen, no, you know, an intimate moment, each person should get pleasure. So he or she, depending on, the dynamic of the relationship, y'all have to make sure each other is coming out on top. So what I do in my clinic, after I do a full thorough assessment and kind of see where you are, they do have this medication called this cream called Scream Cream. And so what it does is it helps bring flow to the clitoral area, and women are having orgasms now. Now, if you're of age, or even some young women, like you say, might have like issues with having orgasm, there's this method called vaginal rejuvenation from an O shot perspective, where they take your blood and they do the blood plasma and they numb your area and then they inject. So what they're doing is rejuvenating. We're bringing the blood cells, the plasma to that area, and women are like reclaiming their feminine. They're having orgasms, they're enjoying sex and things like that. And then we have the vaginal rejuvenation, where it's like a probe, where they insert and rotate. It helps with tightening, it helps with reducing UTI, it helps with lubrication. Both of these methods help with lubrication as
And what
well.
was that? That's the
The
vaginal rejuvenation.
Yeah, vaginal rejuvenation, O shot, scream cream, speaking with a sex therapist, doing role play, inviting your letting your partner know, what's going on, and hopefully they're understanding and can work with you as far as making sure you are pleased.
Okay, I have another question. So a lot of women are, mostly in our area, they are on some type of depression, anxiety, medicine, and stuff like that. And a lot of those have sexual side effects.
Yes.
So what can we kind of look forward to with that if we do have medication?
So unfortunately, you probably can't come off your psychotic medication. So you're gonna need to start another medication or therapy. So you can either do the pills or the psychotic medication plus another medication to help with your sex drive and your orgasms. Or you can also use something that's not as like medication, but you do the cream, like the Scream Cream. It just depends on, like, it's a case by case basis.
Okay. So do you sell the Scream Cream?
Yeah, I prescribe because you can't really get it like over the counter. I prescribe it. It comes from a pharmacy.
Oh, so it's not like that clitoral stimulation that the people be selling. That's not like that. This something on another level.
Yeah, it's on another level.
Oh
Yeah.
wow. Okay.
Yeah.
Oh wow. I thought you was talking about that cream that the fantasy ladies sell.
No, you know what? I don't know about that one. I don't know the ingredients in that one. This is my first time hearing that, but I know
Okay.
from when I did my classes to learn about like the sexual health and stuff like that. Screen cream is what I prescribe to my patients who need help with getting their orgasms, reaching
Wow.
their
So
orgasm.
you can actually go to your doctor about that, or you have to go to your OBGYN to talk about that. Can you tell it to your regular doctor or therapist?
They may not know about it as much, a doctor, but your OB-GYN, depending on their practice, because not all OB-GYNs practice a lot,
Okay.
alike. So if you're looking for something for like sexual help, you need to find OB-GYN that specialize in sexual health and wellness. My
Okay.
clinic, I'm specializing in sexual health and wellness, hormone replacement therapy, and weight loss. So someone like me is where you need to go. A med
Okay.
spa, I want to say maybe med spas may prescribe it if it's a nurse practitioner. She may or may not know about it.
Okay, that's good to know. I'm taking all kind of notes because a lot of times people come on. These are some of the things that we discussed, and I remember one of the ladies talked about the mental health drugs and how she's not in the mood because she went to a sex therapist. Do we have a lot of sex therapists um that's practicing?
They do. You just have to find them. It's not a lot.
Right.
Not a lot.
That's what I was wondering because if you're always looking for different therapists, I don't see too many that, especially in New Orleans, we don't have too many different doctors. I would think Texas would be a little easier to find.
Yeah, I haven't seen too many in Louisiana, but definitely in Houston, while I'm here, I've seen a couple.
Okay. All right. So, is that my last one? I think that is my last. Oh, how often should we do our pap smears? It used to be every year, and then they came back and they told me every 3 years. So, what is it now?
So it's still every 3 to 5 years, depending on your age. However, this is my thing, and the doctor who I work with, she made sense when she said this. First of all, your insurance gonna cover it for free every year. You don't have to come out of pocket. It's covered. Number two, the algorithm that they created that based on is based on like say 90% of the population. The rest of that 10% of the population is somebody mama, somebody sister, somebody daughter, somebody auntie. So she's gonna slip through the cracks. Remember that HPV is for like the pap smear, right? We screen for HPV for cervical cancer. This is my example I use. If you are recently divorced and your pap smear has always been normal, right? And you start dating and you have sex, you think you're gonna wait till 5 years to go get a pap smear? Or I'm gonna
No.
go exactly. So
Right.
by it being a sexually transmitted disease, even with that, if you're not divorced, if your spouse is cheating on you, so what I tell my patient when they ask me that question, I say I wouldn't go over 2 years. Like for me, my for my own self, COVID happened. I think I was supposed to get it 2020, but a lot of stuff shut down, and I wind up not getting it till 2022. I was like, dang, I missed my thing, but I didn't go over my 3 years. Don't tell me you come no 3, 4, 5 years. No, I'm coming now. I'm coming every year. My insurance gonna pay for it for
Right.
free. I'm
Right.
going.
Okay. Yeah. Because, like you say, you have to be your own advocate for
Exactly.
health.
And not only that, when you come for a well woman exam, that includes the pap smear. So we're also taking your vital signs. We can also do your blood work. So if you have hypertension, or we do your blood work if you have high cholesterol, or you on a road to diabetes, we can address that early on. Don't wait. I don't think waiting for 5 years is that's my personal opinion.
Right. And y'all also do a little weight loss over there. Do y'all just do workouts, nutrition? Do y'all do a pill, a shot?
Yeah, so I do personalized meal plans, exercise, weight loss injections, and pills as well.
Okay. All right. So I had this. This was just some of your period self care that you did that you have on your site, and you saying a lot of times when women have periods, self care is not just go and get your nails done.
Right.
So this is something that you have up to take a rest, try meditating, be kind to yourself, drink plenty of water, consume nutritious foods, keep a journal of your feelings, and enjoy some chocolate for the period self care. I also have this. This is your cup,
Yeah, this the disc, the period disc.
the period disc. And I saw one of the questions was, can you have sex with it? So can you?
Yes, you can.
All right. And I guess this would, let me tell you something. It's crazy, but I never, my mother was older when she raised me. So I didn't do tampons. I only did pads my entire time. I didn't learn about tampons till I was a grown woman. I'm talking about grown. I finally did this. So this is new to me. This is just a cup. So I'm not gonna lie, I would be so embarrassed to even ask, like, how do you even use that?
It's not an embarrassing question because I feel like it's new, kind of like new to the market and new to a lot of us.
Right.
Okay. But when I tell you when I first tried it from another brand, it's a total game changer. Total game
Okay.
changer. And
Okay.
everything is not for everybody. There are millions of period discs and cups on the market. You just have to find the one that fits you and your anatomy. And my encouragement is don't give up, because not only does it saves you money because those are reusable. So when you think about $1,000 you spend on period products, your lifetime, you like cutting that in half with that.
That's true. Okay. So that was another question you had. I thought that was interesting. I never even thought about it.
Hmm. Why do some women poop so much on their period? Because of the prostaglandin hormone. When it's released during your cycle, it sometimes is a higher level than in some women than others, and it causes your bowels to move. Sometimes in women to get diarrhea.
Yeah. Wow. And that's it. Like I said, I never even thought about it. It's stuff that we always have. All right. And we talked about this a little earlier that you can actually get pregnant. So you have a very good TikTok. So y'all got to make sure y'all follow. Y'all can see her name right there. She have a very interesting TikTok. The videos are always really good. Um, and that was just a reminder. I like that. So that's your app, and it sends them reminders.
No, that was something I think I created in Canva.
Okay, but that's a
Yeah,
good idea. Those
yes,
reminders, like that stuff, is important. All
yeah,
right. Oh, we talked about STIs. We kind of talked about safe sex a little bit during. This was stuff I wanted to talk about, but I'm glad I have it now. And the last thing, of course, we were talking about the clit. It's more than that little bump.
yes. It's more than a little bump. It's actually a whole, like, you see the piece right there.
Yes. So that's kind of where what's her name? Tiffany Haddish was talking about how all women were born with like I guess a penis or whatever. That's what that is. I'm assuming.
Yeah, that's what I guess is what she was referring to. Yeah,
Right. Okay. So it's important that women, you have to also know your body as well. So you have to know about, your all these different things, your vulva, your clitoris, like all kind of stuff. Because I'm sure you're not surprised, but a lot of grown women and men don't even really know the anatomy of a woman.
yes. I saw a provider. She gave me a good idea. She uses a mirror
Hmm.
with her patients to show them their vagina. And some women are saying, like, these are grown women. Oh, I've never looked at it like down there. I'm like, girl, you better be opening up them lips
Right. You
and
gotta
doing
look.
everything. Yes,
Yeah, you
know
gotta
your
check in there.
body. Yes.
Okay. All right. So my closing question is, if you could go back in time and talk to 17-year-old you just to tell her about life, what would you tell her?
Oh,
Think about you at 17.
I would probably say, and you know what? To be honest, I did everything that my mama really kind of like told me, her and my uncle. I went to nursing school. I graduated. I bought a rental property. Um, as far as relationship wise, I don't think I should have been wiser. Relationship, leave those knuckleheads alone. That's what I would tell my 17-year-old self. Yeah.
Okay. All right. So one more time, let them know how they can follow you. Tell them your TikTok and your Instagram and your website.
Yeah. So you can follow me on Instagram. It's at Vagesty, VAGESTY_ TikTok is Hello Vagesty. And my website is www.vagesty.com. That's VAGESTY. I'm also on YouTube. If you go to my Instagram or even my TikTok, all my links to my social media and as well as YouTube is in the bio.
In the bio. Okay, so they can follow and keep up with everything. But you definitely want to keep up because she have a lot of tips, especially with feminine tips. And as women, a lot of times we are embarrassed and we don't go as much as we should. So please make sure y'all follow and keep up and buy that box because it has a lot of stuff in it. And they
Yes,
put it together in a kit. So I'm actually gonna get one myself as well because, like you said, with the boric acid and all those different things that we could keep up with our health. And you
yes,
even have, I saw you had like lubrication cream. You had a lot of different things on your site that you're selling as well. So in the scrub. That's a good idea. That's good too.
Yes, the scrub is actually one of the best sellers. Yes.
The scrub, okay, and that comes in that package as well.
Yeah, it comes in a package.
All right, so they definitely want
Everything
to get
comes in
that.
a package except the lubricant, but the Yanni oil comes in a package. The
The Yanni
lubricant
oil.
and the period stuff don't come in the box.
Okay, y'all, we got to take care of our girl down there because she's gonna be with us forever. So make sure y'all
Yeah.
treat her right. Y'all gotta treat her right, treat her good, keep her clean, and how they say, be good to her and she will be good to you.
Exactly. Period.
Right? Period. So we have come to the end of the show. Thank y'all for sticking with us. Thank you so much for being here.
And
And
thank you for having me. I was
of
excited when you said
course.
like, yes, of course.
Yes, and I don't know how I didn't think of it sooner, but you have been doing an excellent job. You know, people always watching, and I'm one of those people that admire everything that you got going on. You're doing really well.
Thank you. Appreciate
All
that.
right. So, of course, y'all, thank y'all so much for sticking with us to the end. I hope y'all learned something. If you have a question, you can, jot it down, send it to me. Remember to like, subscribe, share, hit the notifications. And if y'all have any questions, send it to me. And if the law say the same, I'll see y'all next week. Bye-bye.